this instead. I put you through torture already for a couple of years. Hey guys, it's Dr. Emer. We're in West Hollywood today, and we're doing young patient's facial rejuvenation treatment. This is kind of his bigger, every few months, a quarterly treatment where we do, I call it the tight and bright procedure, but at least preventative, where we do deep microneedling radiofrequency first, which is what we're doing right now. This is Fractora. You can see the pinpoint bleeding, signifying that we're getting to the lower levels of the dermis, which is where we want collagen production and tightening. He actually has a nerve block and topicals, so he's going to feel much less. Now, the nerve blocks can't do all of the face. There's small areas that he'll feel like a little bit here in the center, exactly. But when we get over here to the side, he probably won't feel this as much.
Not really.
Exactly. So what's happening here is we're going deep, and we're getting a lot more tightening here, and it's good for pores and scars. I'll show you guys, there's different pins. There's a 24 pin, there's a 60 pin. When you use the larger pin, it's smaller in depth, so you're treating more of the surface wrinkles. When you're using the deeper pins, you're treating more of the tightening, the pores, the acne scars. Now you can't numb everything on the side, so he'll feel a little bit as we get over here. And you guys can see, if you take a look, here's the pins there, 24 pins, 3.5 millimeters in depth. You can see all that pinpoint bleeding up on the forehead. That's a great sign. Turn all the way left, and what I'm gonna have you do ice now, hold on this side of your face. There you go. He's gonna pre-ice on one side because small areas like here on the side, I can't fully numb, so he's gonna feel a little bit. And as we go more towards the middle though, he won't feel nearly as much. But the reason we're doing this is we're going deep first to get a lot of tightening. Then we're gonna go superficially using both Fraxel and Erbium to help sun damage and scars. And then we're gonna microneedle for healing and also just improvement overall. Luckily, the Fractora treatment's really quick because in some patients it's painful. Breaths, great.
Is this safe for all skin types?
Yeah, it is. There's different types of needles. This is the uncoated needle because we want to get him a lot of improvement throughout all of his skin. There's also a coated needle that you can use for those that are darker skin type. He's doing really good. You can see, you know, we press those needles into the skin so we get a nice depth of treatment, and then the surrounding area is just pink. Now, one of the places, and I'm gonna, is turn your neck up for me. You're gonna feel this a little bit because we can't do nerve blocks here. We're now gonna go to the neck, and this is a really important area in my opinion for people in general. One, it's preventative and everyone wants tightening. With lasers, you don't get tightening of this area, and men specifically really like jaw lines to be tighter lately. The other thing is he's blonde hair, blue eyes. He's way higher risk for skin cancer, and one of the reasons why we even started these treatments was because of that. Sorry. And these treatments will not only be preventative for tightening, but also preventative for skin cancer because we're going to be treating the surface. All right, do me a favor. I'm going to give you this on this side now.
How soon should people start doing these treatments?
Young. As soon as they can. Affordability and time. I think it's really important for people to start doing these to prevent. Now, listen, I also think that people look good as they age, and it's up to them, you know, how they look and how they express their skin to the world. Some of my patients want to look really young and keep themselves looking young, so we're doing these treatments much younger nowadays for prevention. Also, my acne scarring patients, you know, they're very depressed with their skin, and it needs lifelong treatments to get improvement. My patient here uses skincare. He comes in for facials, but he looks like 10 years younger than he is. I'm not going to tell anyone his age, but he looks like 20. So I think a lot of that has to do with the fact that he doesn't sit in the sun, takes really good care of his skin, is following protocols. It's really helping him. So this is, again, come real up close if you can, show people the Fractora device, the little stamper with the needles. And we'll finish this up, and then we will go over to the Fraxel in a second. Good. All done. Okay, take this away for a sec. We're almost done. Now look.